discussing blood test abnormalities in multiple sclerosis and their link to parasites. If we haven't met, my name is Pam Bartha. I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed with multiple sclerosis 35 years ago, over 35 years ago. And by the grace of God, I learned early on that the MS that I was suffering with was caused by infections. At the start, we learned about Candida, then we learned about Lyme disease. And in the last few years, we've been learning about the larger parasites, the protists and the worms, etc., that are also playing a really big part in multiple sclerosis. And what I hope to do, and I know that we are attracting the attention of different health experts around the world that really care, that really want to make a difference. And what I would really like to encourage is others to do this research also. So I'm kind of giving some starting points, and then I'm hoping that other people will also help in the research, because we don't have good tests. And so it's really important that because we can't just do a good stool test, we can't just do a good DNA test to find out which parasites we have. So then we have to look at symptoms. We also have to look at blood test results, what we're finding in the blood. And yes, there is some overlap, but what would be really nice is to make an app, right? To put all of the, specific symptoms and specific blood work that we would see with each specific infection, especially the ones that really are commonly linked with multiple sclerosis. And then we can do that for cancer, and we can do that for arthritis, and we can do that for different diseases, because they're all infectious diseases caused by parasites. But parasites like to live in different parts of the body and cause different symptoms. So that's why those of us with different disease labels is because we have different types of parasites living in different parts of the body. But we often have very, very similar parasites also. So you guys go ahead and type your questions in the question box and type in your comments as we go along. But multiple sclerosis, like since I was diagnosed over 35 years ago, it has always been considered to be an inflammatory disease. We know that, we agree with that, but they call it an autoimmune disease, meaning that our immune system is attacking our nerve tissue for no apparent reason. Like there's some immune dysfunction going on, and that the wise pharmaceutical companies, they've created these drugs that would suppress our out of control immune system so that it is not attacking our nerve tissue. So we've been doing that for many, many years. Again, I was diagnosed over 35 years ago. So for at least like many years more than that, that was the premise for multiple sclerosis. It's like it's an immune disease. We have to suppress the immune system. How's that been working for us? What do you guys think? Has that been really helpful? So now we've got over 20 disease-modifying immunosuppressive MS drugs that we're supposed to take as long as we live, or as long as our body will tolerate these drugs, and we still progress to disability. So if there's relapsing remitting and then a couple of types of progressive multiple sclerosis, or in maybe the clinically isolated, like where people get one attack, et cetera. So maybe say there's like 4 types of MS. Why do we need 20 different MS drugs? If they work so well, do we really need 20? No, we don't. So the paradigm, the way of thinking, the premise of what we believe MS to be, maybe we're wrong. Maybe we're on a path that leads to nowhere. And I would argue that we are. I would argue that as we continue this journey with autoimmune, calling MS an autoimmune disease, it's literally just created an industry. It's created the multiple sclerosis industry. And maybe you didn't have MS, maybe you had cancer. So it's created also a cancer industry, an arthritis industry, and all of these different industries, the inflammatory bowel disease industry. And so we have all of these niches in healthcare where we have separate diseases. We have hundreds of billions of dollars in each industry, so trillions of dollars in our standard of care. So maybe our standard of care got off track. Maybe, and I'm not going to speculate as to intentions or no intentions, but maybe we're on a completely wrong path. And maybe if we stay on this path, we're never, ever going to find a cure. And haven't you noticed how now we don't really talk about cures anymore? We talk about disease modifying, managing disease, living, trying to slow it down, slowing down the progression. It's like, why? Why have we given up on finding a cure? Is it really that hard? And I would argue that no, it is not that hard. But if we stay with this paradigm that we're in, it will never happen. So again, over 35 years, we're no closer to a cure. We don't know what causes MS. And those of us that are dealing with chronic disease like MS and other diseases, we're done with that. Aren't you done with it? I'm certainly done with that. So we don't want to settle with managing the sickness we have. We want a cure. We want our life back. We want our health back. We want to do the things that we used to love to do. So first of all, what causes multiple sclerosis? Again, they don't know what causes it, but if we could figure out what causes MS, that would be amazing. And so what other things could we look at to look or to find what the cause of multiple sclerosis is? So one interesting thing that I found out, and this is for many, many years, that researchers found that there's a really strong relationship between where people that have multiple sclerosis have a much higher incidence of small blood vessel damage in the brain. All right. So, and then another important thing is that wherever there's a lesion in the central nervous system, that lesion is centered around a blood vessel. So it's like, what came first, the lesion or the blood vessel? What if the blood vessel damage became first? So let's look at, what is going on in the lesion. Well, the lesion is a pocket of inflammation. Sometimes they call it a lesion, sometimes they call it a plaque. And so with that lesion or that plaque, we know that there's a lot of inflammation going on inside that lesion. It's a pocket of inflammation. So what is inflammation? If you follow my work, you know that inflammation is the war zone. It's where all the damage is occurring, where the immune system is trying to destroy an enemy. It's trying to do its job. The main job of the immune system is to defend us from different types of parasites. A parasite is any microbe that lives inside of us and causes us harm. So the immune system is fighting something. It's trying to protect. It's like, okay, whatever this is, it shouldn't be in the brain, and it's going after it. So it is a pocket of inflammation. And again, we know that the immune system is involved. And what if it's not that the immune system is dysfunctional? What if the war is out of control? What if the immune system is just not able to deal with the infection? What if we had these infections for years and it gets to a point where our immune system is not able to deal with it as well? And if that's the case, should we be suppressing our immune system or should we be supporting it? So why don't we try to do some research and figure out, why is there damage to these small blood vessels in the brain of MS patients? Why is there a higher incidence of leaky brain? And so that's where the blood vessels, they're leaky. The blood-brain barrier is leaky. We have more microbleeds. We have these capillary hemorrhages with multiple sclerosis. So those are the very, very small blood vessels where there's an exchange of waste material and oxygen and carbon dioxide and food, nutrients, etc. So there's exchanges of that's kind of like the port where things are transported in and out of the brain. And so why is it that there are damages to those little vessels? Are they getting blocked? Is there something that's hurting them? Is there an infection that's breaking them open, or are they becoming blocked by something? If there's that much evidence that multiple sclerosis, and this was already in, let's say, 1982, they found iron deposits around the lesions. So around the outside of the lesions, they found iron deposits, researchers did, and that would suggest that red blood cells, so that would suggest, if a blood vessel breaks and then there's leaking of red blood cells into that area, because red blood cells carry the hemoglobin, they carry the iron. So then you could see a ring of iron there. So we know again that lesions are centered around small blood vessels. We know that there's a lot of increase in different cardio disorders in multiple sclerosis. So microbleeds, reduced blood flow in the brain. We know about CCSVI years ago. There was a doctor who, for his wife who had MS, really thought of the idea of doing the CCSVI where they're opening up the veins because they're more narrowed. And there's also diminished neurovascular activity in multiple sclerosis. So the blood vessels are supposed to dilate at certain times, again, with changing circumstances, and they're not as reactive as they should be. So all of these hints, clues point to, and also talking about different blood tests, we can often see that people that have MS, they're anemic, or they have been anemic at some point in their life. Very, very common. They also have changes in their red blood cells. So where we can find we have less red blood cells, we can find that the red blood cells are larger than normal. We can find that the volume is bigger, and we may have less red blood cells. We have less hemoglobin. So, and our platelets can be increased with multiple sclerosis. So these are all things that, let me know if your neurologist even looked for when he was trying to diagnose you with multiple sclerosis, or when you've had a checkup. Like, are these things that they're specifically looking for? I don't think so. I think they're only looking for lesions, or if you've had the lumbar puncture, then they would also be looking for bands of antibodies. And again, antibodies, it's your immune system is fighting some type of infection. So hypothetically, if we had these parasites that would infect our red blood cells and cause them to be stickier, and they stick together, and we have inflammation, and we have damage to the blood vessels, the very small ones, not just in our central nervous system, but also in different parts of our body. So, and also there's higher incidence of stroke with MS. And so if you have, and I'll go on to it later, but basically heart attacks higher in MS. So there's all kinds of different cardiovascular disorder symptoms, clues with so is multiple sclerosis a vascular disease when you look at all of that? And then maybe if some of these little blood vessels break in our central nervous system, and then we get leaking of the components that are in those small blood vessels into the brain, of course our immune system is going to go, hey, we got to clean up here. We got to, all these different cells are moving in, red blood cells are moving in, white blood cells obviously would be there. Parasites, we know that the central nervous system is not a sterile environment. We know that there are still also parasites located in our blood. So all of a sudden, the integrity of the blood-brain barrier is broken, and we end up with things leaking into the brain. And then we can end up with inflammation. We can end up with our immune system is really trying to clean up the mess. And so that can be a really big factor in what's causing MS. So is the immune system just doing its job, and it needs some help and it needs some support? And I would say yes, because that's what we see in our students. Because when we treat the parasites, then we no longer have this so-called autoimmune disease. Our immune system does not attack itself when you treat the parasites. So it never did, I don't believe. I believe that the parasites can cause immune dysfunction. They have lots of ways to hide from the immune system, to cause the immune system not to maybe work optimally when it's like overwhelmed with infection, when it's not able to do its job. But it is generally very, very, very intelligently designed knows how to protect us, but there are times when we need to really help out. And I think that those situations are increasing in our time because we're exposed to a lot of things we weren't in the past. So for myself, months of antibiotics, and that really devastates our ecosystem. Tetracycline for months for acne. And many of us have been on antibiotics a lot. So that decreases our health promoting microbes, and then we're susceptible to parasites. But then we're dealing with things that are the geoengineering, the spraying. We're dealing with the things in our sky. I'm not going to talk about that here, but that's a really big topic. And then also the wireless radiation that really can impact all kinds of things in our body. The heavy metal toxicity we're dealing. So we're dealing with a lot of things that we would not have been dealing with maybe 50 years ago or 60 years ago. And that's probably why we have such a greater amount of parasitic load, because our immune system is more taxed also. So again, inflammation is present in all disease, not just multiple sclerosis. And inflammation means your immune system is fighting something. Usually it's parasites. Usually it's disease-causing parasites. And the immune system protects us from parasites. That's the primary job. But also any other substance that shouldn't be in our blood, shouldn't be in our brain, it knows what should be there and what shouldn't be there. And so if we look at just some of the common parasites that I've talked about, for example, that are linked with multiple sclerosis. So we knew in the early days when I was first diagnosed that Candida was really linked with multiple sclerosis. And through the research I did, that people that have a lot of chronic Candida, they can end up with a lot of anemia also. And it's hard to know now, like so many years later, like almost 40 years later, it's like, well, was it the other coexisting parasites that caused the anemia and the Candida was just there? But Candida does definitely like hemoglobin, so it can be involved in anemia for sure. Then we started to learn about Lyme disease, and we know that Lyme disease can cause Lyme carditis, so it can cause inflammation in the heart. It gets into the central nervous system. It can definitely impact our blood. And then we learned about the different types of worms. So we've learned about the tapeworm present in the larva of the tapeworm present in the central nervous system of MS patients. We call that neurocysticercosis. That's really linked with anemia. But then also if we have a lot of roundworms, that's also linked with anemia. I've taught you about babesia and malaria, how those are protists. And protist is a single cell parasites and how they're really linked with, they infect our red blood cells. So if we get our blood work done and we notice that we have, like less red blood cells and they're bigger in volume and we're dealing with anemia, those are all really big clues that maybe we're dealing with a protist also. And it's never going to be just one parasite. I wish it was. It's not like you get strep throat and you go to your doctor and you get antibiotics for a week and you're cured. When you have chronic disease, you've got chronic parasitic infections. And so then you have to be aware that you're going to be, and it's like dysbiosis. That's what we call it. We're out of balance. We have too many disease-causing microbes and not enough health promoting microbes. And then we need to treat a variety of parasites. So we know that tapeworms, again, can cause anemia directly and indirectly by eating iron, by taking hemoglobin, affecting our red blood cells, causing B12, vitamin B12 deficiencies. And then we know that the Lyme disease can cause arrhythmias. We know babesia can also cause a racing heart and heart issues. So all of these things, like, we have to consider, and this is where it would be really nice to build an app. I wish I had more time. Maybe I can do this. I don't know. Maybe with a team of people we can do this, but it would be really nice to just build, with AI, it might not be as hard, where you take all of the symptoms of each common parasite, especially the ones to start off with that we know are present in multiple sclerosis. So we know about the neurocysticercosis, the tapeworm larva, and juvenile tapeworms in the central nervous system. So symptoms they produce and the changes in blood work we could see with that. Also Lyme disease symptoms they produce, and the specific changes in blood work that we would see. And then also the filarial worms. What would we see? And the filarial worms, honestly, are maybe yes, they are actually in our blood also. But Babesia, malaria, that's pretty easy. That's where you really notice a lot of changes in the red blood cells. So like something that is infecting our red blood cells. So and another important thing too is that the inflammation, and so this may not just be with one specific parasite, but if you have the damaged blood vessels, the small ones, then that would activate our platelets because they will build a clot to stop the leakage of the blood vessel. But platelets are also involved in inflammation in different ways too. So we often see increased activity of an increased platelets also when we're dealing with parasites. So I believe that all of these parameters are really, really overlooked. They're focusing mostly only on, unless something's really out. Like for example, for myself, there are certain red blood cell test results that were always like out of the normal range for me. And the doctor's like, oh, who knows? Maybe that's just who you are. I'm like, no, there's something there. And then when you have a lot of other symptoms of babesia, and then you've got the blood work to also show that your red blood cells are being really impacted, that's a really huge clue that would be babesia or malaria, or a type of protist similar to those would be infecting your red blood cells, because they do cause a lot of symptoms. And another important thing too is that I've done lots of live events. So one of them I shared with you how there are many different parasites that cause lesions in the central nervous system. That's just well known. And there's lots of parasites that cause anemia, and there's lots of parasites that get into the central nervous system that it's been documented for when you're talking about babesia and malaria for over 100 years, and also for Lyme, like spirochete, corkscrew type bacteria. So the affecting our red blood cells can be directly, but it could also be loss of blood too, like if we have more bleeding. Let's see, I think I covered most of it. So like our vitamin B12. Oh, and then Lyme can also affect our vitamin D levels. So it's not just that we're deficient in vitamin D, but it's that the parasites make us deficient in vitamin D. They make us deficient in iron, and then that can affect all different parts of our body. So it's really important to become the director of your health. It's really important to understand how to read your blood work. Even like white blood count, if it's chronically low, if your white blood count is chronically low, that can definitely be a sign of chronic parasitic infections. So very, very important. All right, I'm going to go to your questions, see if you have any questions. So let me know if you read your blood work, or if you just leave that up to your doctor, if you actually get the results and you look at the reference range and you see if it's high normal, low normal, if it's in a good range, or if you've noticed any changes with your red blood cells or your platelets or your white blood count. Usually when we have these chronic parasitic infections, we notice that we have low lymphocytes, we can have low white blood count. Hello. Hi, David. You'd be interested in working on a symptom app? That's awesome. Well, reach out to us. Just go to info@livediseasefree.com, info@livediseasefree.com. We'd need somebody who's a little bit of a techie person, who's or somebody who's good at making apps. But we would also need, and I'll check with my students because I know we have the MSIDI, the Multiple Sclerosis Infectious Disease Initiative, but it just needs manpower because literally between everything that I'm doing, I don't have a lot of extra time, unfortunately. Your doctor said there are 27 different MS drugs. That could be by now. That number that I got from the internet, from Google, is probably old. And so, like, doesn't that make you suspicious when there's 27 MS drugs? It's just crazy. Like, why? If, like, if there's a cure, if they work, why do you need 27? So, Jake, you're 100% right. They know it, but it's all about the money. And, the only way things are going to change is when we just demand change. So, when we get to the place where, you like, we work with very forward thinking people. And if they get symptoms, they go, okay, I don't like this. I don't even want an MS diagnosis. So they just start searching and searching, and they find us and they go, parasites. That makes a lot of sense. They've had symptoms of parasites. And that's another thing I wanted to mention too, is that when you look at all of the symptoms of the blood work and the symptoms of MS and other chronic diseases, those are symptoms of parasites. Like, they're exactly the same symptoms of parasites. They're the same symptoms that you would see in parasites in animals, in pets. And so it's like there's the same blood work, the same symptoms. But we don't have parasites in developed countries. Like, really? Why did I just treat my dogs today if we don't have parasites in developed countries? And the produce is coming in from other countries. They're in our soil. Yes, we're supposed to treat our water. We're supposed to have cleaner water, but otherwise we are exposed to parasites every day. It's just part of life. But for people like myself and maybe you that have used too many antibiotics, we are like a sitting duck. We are like really at risk of a parasitic infestation because we've lost our natural defense. We've lost that ecosystem, and we didn't know, and our doctors didn't know. And years later, the parasites built up and moved into the blood and moved into our organs and moved into the central nervous system. And they're affecting all of our blood work too, and we're ignoring all of it. And it is all about the money. And it's awful to say, but that is true. What are your thoughts on this, Deborah saying? So, announced a positive test for results for MS trial. I'm not sure what that is. It's an acronym. I'm not sure. That's probably not the gold. There's a gold therapy. Again, it's like, oh, the mobility improved by, I think, like 14%. It's like, no, we don't want that anymore. We just want to get on with our life. They all announce good results on trials, and that's true. So, for example, even with Copaxone, when years and years ago, one of the very first MS drugs, they're like, oh, there's like a 30% improvement in MS patients. And then years later, they're like, oh, there was no difference. There was no benefit. And it was toxic to virtually every part of the body. So there's a lot of corruption going on. So you're saying that there's a doctor that has some herbal parasite detox that you're getting prepared to do. And that's great. If you don't have chronic disease and there's lots of parasite detoxes. You can go to the health food store. There's lots of great ones. There's even Brenda's deworming. So you can make your own blend. You can buy blends, and you probably will pass a couple of parasites, and hopefully you'll feel better. But trust me, if it was that simple, I would not have to do this work. So we cannot recover at this time. We have tried exhaustively just to use herbs, and we have not been able to help people like recover like we do with using the whole plan. So number one, you have to stop feeding the parasites. You've got to decrease the food, and their favorite food is carbohydrates. I did a talk on that just a couple of weeks ago. That's their favorite source of energy. Then we have to support the body, get the bowels moving, sleeping, and then, making sure we check our blood work, right? And checking, and all of this helps us to, that's one of the pieces of figuring out what treatments we need, is looking at our blood work, looking at our symptoms, looking at our energy test results. And then we use a combination of parasite drugs, herbs, and oxygen therapies. And when you use all three together, that's where people are recovering from chronic disease. And it takes a few treatment cycles depending on how infested we are. But, there are so many detox herbal blends, and I wouldn't advocate for them just because I have found that they're just not enough. I love herbs. They're part of the recovery plan, but on their own at this time, we have not found that they are enough on their own. But if you're healthy and you just maybe had a little bit of gut issues and you want to do a periodic cleanse with herbs, there's no harm in doing that, as long as you make sure to, if you're taking any medication, make sure to check with pharmacists. There's no negative interactions, because herbs are natural medicines. So make sure that they do not interact with what you are taking. David, I can help with building the app as well. Awesome. Well, just reach out to us. And but before we even build the app, we're going to need, and I'm going to reach out to some people in particular in the academy and just, maybe have a meeting here or there and just kind of look at like, how are we going to build this? Because I think that, like there's a lot of bad things about AI, but this could be helpful because it can pull together information really quickly. And then we could, because we can't wait for tests. Tests are not going to be helping us. And if we had a diagnostic tool for practitioners, I know that there would be more doctors that would be interested in helping treat parasites in their patients. So that could be really helpful, I think. The doctors need like in Canada, for example, like in the United States, the doctors have a little bit more autonomy, a little bit more freedom, but Australia, New Zealand, Canada, we're also under the control of this other organization in Europe. But it's so regulated here that it's very scary for doctors to step out of the standard of care. They have to follow the way that the standard of care is. And if they don't, they can lose their license and maybe even more, get fined, etc. So they need diagnostic tools to protect themselves. And then also too, when you're passing the parasites, make sure to take pictures of what you're passing and use a measuring device beside it so that they can tell how long it is, but that's another really important tool. So what I'm all about helping people recover. So we have the Live Disease-Free plan, and we have students in the program. We have a lot of healthcare professionals that take our program too, which is crazy because I'm not a healthcare professional, but there's very, very few places that have a proven plan that works really well to help people recover from parasitic infestations that cause chronic disease. But my goal is that this would be part of our standard of care, that our doctors, our GPs would go, oh, you've got symptoms of fatigue, your gut is off, your balance is a little bit off, you're dealing with allergies, sounds like you're dealing with parasites. So let's run it through this diagnostic tool and let's see. And okay, well, it looks like you could have this, this, or this, right? Or these 2 or 3 different parasites. And so then they can use your health history, your symptoms, and they can use what you've been exposed to, right? Like, do you live on a farm? Do you have animals? Do you eat sushi, right? What kind of things are in your life that expose you to parasites? And all of those things will help them to kind of figure out, roundworms, tapeworms, flukes, protists, etc. And I think that would be a quicker way that we can actually have a diagnostic tool, because with DNA testing, there's the good part of it is that, every organism in this world has a specific DNA blueprint. But when you're doing the sample, when you're taking the sample, it's such a small sample size that you may or you may not be taking in the DNA of the parasites that you're dealing with. And they're only as good as the number of parasites that they sequence for in their test. So that's been not really helpful right now. The stool test, the analysis, just visualizing for eggs and larvae, that's a total disaster. Like, the people that are looking don't even know what they're looking for. They're not trained. In Canada, in British Columbia, they don't even look for worms. It's just insane. And we have worms in British Columbia, Canada, like every other country. But that's not, and people don't even know that. So they think they're getting a stool test. They think they're getting tested for worms. And one of my students had the stool test done, and her doctor and the lab informed her that they're not even testing for worms. Incredible. They'll test for certain protozoa and certain bacteria, the very small single cell parasites, but they will not test for worms. What's the best diet? Jake is wondering if we don't want to feed the parasites. So that would be the Live Disease Free diet. You'll find the guidelines on our website, livediseasefree.com. The guidelines are free. You can go under research in the main menu, and there you will find a cheat sheet you can put in your kitchen. You'll find a short video. You'll know exactly what to eat. And the whole premise is get the carbs low enough so that the parasites are less active. Then you will notice the immune system doesn't have to fight as hard. Inflammation goes down. This is immune modulation. And with immune modulation, you notice a lot of symptom improvements. But this is like all or nothing. Like if you decrease the carbs a little bit, you might have a little bit of improvement. If you're really strict and you get down to the 30 total grams of carbs per day, then it's like, oh my gosh, like I cannot believe how much better I feel. So that's really important. So that is to make the parasites less active before you treat them. Then we want to support the body. Again, daily bowel movements, sleeping at least 8 hours per night, looking at our blood work, supporting areas that need it. So let's say we're anemic. We're not going to take a prescription. You can, but I personally wouldn't take a high dose iron supplement, not a supplement, but a medication that you would get from a doctor, because it's very constipating. And when you take mega doses of B vitamins, of D vitamins, of iron, you will feed the parasites more also. So you want to take just enough that it's helping you, but it's not really helping the parasites a lot. So you want to support your physiology, and you're feeling a lot better before you even start treating. And then when you're treating, again, you get energy tested. So you're taking each of the common parasite drugs and herbs, and you're saying, which ones support me, make me stronger through energy testing. And then we use those treatments, and we do cycles of treatment. So this is where we have to, maybe treat the larger worms. We treat from large to small, larger worms and protists for 10 to 14 days. 14 days would be better. Then we treat fungus for about 10 days, and then we take a break week. During the break week, it's not like we don't treat, but we're just using more of the oxygen therapies, which I can't talk about here because the one that I like the best is super cheap, cost effective, and it is heavily censored. You can find out information about that on our website, livediseasefree.com. You can just do a Google search of Live Disease Free and oxygen therapies to treat parasites. So our website, the blogs, posts on our website, the posts under blog are incredibly helpful. Go through them. It will really help you to understand. You need to have a different mindset if you want to be a wellness champion. And I call them the leaders, the trailblazers, and the forward thinkers, because they think differently than other people. They don't just buy into what they've been told. They use their intuition, they use their common sense, they research, and they're the ones that are just finding us and taking back their health and life and moving on with their life and not living with chronic disease. Okay, yeah, Deborah, that's the one that has gold in it. I personally think that's another gimmick. I would not do that. So gold and silver are metals, and they're not extremely toxic. So they're not like mercury or like lead, etc. But if you get too much silver in you, your skin can turn kind of a bluey gray color. The same with gold. Like, it's not a cure. It has, like, these metals have antimicrobial properties, but why would you, like, if you follow our diet, you'll have more symptom improvement than the disease modifying drugs and probably that gold treatment also. So just lower your carbs. And then if you really research a little bit, like go on our blog post and start learning about the parasites and the different types and see the pictures of what our students have passed, some of which I have passed also, then you're going to be at the place where you're like, well, no, I just want to treat the infections. Like, I don't want to just take something that is kind of like even like a herb. Like if you just only rely on garlic, garlic is really awesome. It can make you feel a lot better, maybe equally to what gold can. And then that gold, that new therapy, but it's way cheaper and it's non-toxic, but it's not enough. It's, what is your goal? Is your goal to recover? If you want to recover, then you have to use effective parasite treatments. And the parasite drugs are, again, they're not a magic pill cure. I wish they would. They are not going to sterilize your body. But when you use all the plans in the program, the steps in the program, and you also use a layering of therapy, so you're using not just the parasite drugs, but herbs and oxygen, and you're cycling through this several times, you've got to decrease the burden over multiple cycles. If you just rely on parasite drugs, they can build up a resistance, especially if you're not using effective doses. You're so incredibly welcome, David. Thank you for your kind words. So, Deborah, you've had MS for 25 years and you've never taken MS drugs. Way to go. You are a forward thinker then, because not a lot of people would have done what you did, because very often when we get in their offices, they scare us. It's like, if you don't take this drug, you're going to be in a wheelchair. You're going to be in a care home. And so for you to actually understand that it's not that you're against pharmaceuticals. Obviously, if we were in a car accident and they've got to put us back together, we're probably going to need a pain medication, but that's short term for a very specific reason. It's the disease modifying maintenance drugs, immunosuppressive drugs, that are the problem. And as far as red meat and pork, so that's really preference. If you don't want to eat pork, fine. But red meat there's nothing unhealthy about it. There are people that have multiple sclerosis that are following a carnivore diet, and it's better than the North American diet. And if the red meat was bad for them, they'd feel worse. So the red meat or beef is not bad. Obviously, trying to get, the grass-fed beef, organic beef would be much better if you can. Anything, right? Avoid GMO, all of that. But it's not bad for you, the beef, unless you're sensitive. You could be sensitive to anything if you have leaky gut. So if there's a food that bothers you, avoid it. But there is nothing wrong with red meat. I eat it regularly. It makes me feel very strong. I thoroughly enjoy it. So there's nothing wrong with it. But definitely the artificial sweeteners, the sugar is the problem. That's like putting gas on a fire. That will feed the parasites like nothing else. You're so welcome, Jake. Thank you so much for your kindness. Videos for doctor, microscopic image analysis using AI on stool samples. Oh, wow. We need to take matters into our own hands. So microscopic image analysis using AI. That's a really good idea. Where you could take so you could use AI to basically look at, but then we can't do it ourselves, because you've got to prepare a sample, right? You've got to have and also you want to be looking at different samples in different parts of the stool, et cetera. And you have to be really careful with stool. There's a lot of unhealthy microbes. So, but somehow if we could do, I know that there's one lady that's communicating with me, and she has been looking at different slides and finding little tapeworm cysts in the esophagus tissue of somebody. And so, but maybe AI can actually look at those slides and pick out things that humans would miss. I don't know if we're there with AI or not. I don't like AI at all. But I mean, for something like that, you could use it for good and bad. And if you used it for good, I'd be all for it. Weekly fasting always helps. So you might feel better, David, when you fast when you're not eating, because the parasites are going to be more quiet when you're not eating. But then as soon as you start eating, they will start feasting right along with you. So it's better. Fasting is fine, but you want to treat the parasites. Otherwise, you're carrying this burden of parasites with you, and they multiply every year in your body. They become more populated. They don't become less populated. They love it in our bodies. It's warm, it's moist, there's lots of food. So if you don't actively treat them, they over time, and that's when you look at the care homes and you look at the seniors that are quite disabled and they have no cognitive function, and they're losing, they can't remember anything and they can't walk. Those people are infested with parasites. So the better you are at managing them, the longer you live and the better quality of life you will have. That is the biggest missing piece of the wellness puzzle. Okay, a last couple of questions here. Oxygen therapy, yes, Christy. I can't say the name here, but because it's completely censored, it's way cheaper. I won't even say, but there's different types of oxygen therapies, and this one is my favorite. And you can find that on Rumble, or you can find that on Live Disease Free Oxygen Therapies to treat multiple sclerosis. And it's for others too, right? Everything that I share with you, I do talk a lot about MS just because that was my history, but all chronic diseases, including cancer and heart disease, they're all infectious diseases. They're all caused by different types of parasites. Will oxygen therapies cancel the effectiveness of antiparasitics? No, they can be taken together. The only thing is we don't do too much at one time. So this is where we have to manage the die-off. If people are really sick and weak, we first build them up with supporting the body in the diet, and then we bring in the treatments as is tolerated. Even the parasite drugs, if they test well for 5 parasite drugs, they're not going to start with 5 parasite drugs. But eventually, as they tolerate it, it's really helpful because it's a better killing effect. One parasite drug does not get rid of all the tapeworms. I'm sorry, I wish it would, but it does not. And what's a really big joke is like our students, like they're doing like 14 days of worm medication and they're doing cycles of that. And they're taking, let's say, 3 or 4 of these parasite worm medications for 14 days. And then you go to the vet and your vet says, oh, here's one pill that will treat all the heartworms and the roundworms and the hookworms and all the worms, the tapeworms in your dog for, however long. And it's like, I don't think so. Like, if we can't get them out of humans, if they're that hard to get out of humans, I don't think so. It helps, but that's where even the vets, they know more about parasites than our doctors do, but not much more. So Deborah, they told me that I wouldn't get my eyesight back if I didn't go on the drugs. I said no, and you got your eyesight back 2 weeks later. Congratulations, awesome. So the truth of the matter is they probably would have given you cortisone or prednisone for when you had optic neuritis, and that does not improve the amount of vision that comes back. So I even know that. What it does is that if you are going to get any improvement, it may accelerate you getting back your vision, but it's not going to give you more vision back. But it will really suppress your immune system. Do you have suggestions on how to manage sugar cravings? Yes. So with the Live Disease-Free diet, you're eating regularly. So if you eat regularly, really important because you're keeping your blood sugar steady. And make sure you're having protein, and so animal protein, and you're having fat with every meal with low carb vegetables, obviously. So, and you're eating when you're not even really hungry. So you'll notice that when you follow the Live Disease-Free diet, you'll feel really satisfied. And you'll be like, I don't need this snack, or I'm so busy, I'm just going to skip lunch. I'm not that hungry anyhow. And if you do that, you'll lose weight. But if you keep your blood sugar level steady by having protein and fat with every meal with your low carb vegetables, and really just go cold turkey. If you keep having little cheats here and there, you will keep perpetuating. But again, if you eat regularly and you're satisfied, and make sure you don't have the processed carbs in the house, usually within 7 to 10 days, you'll be over the hump of it. And caffeine is another one where people get headaches when they come off of that, but caffeine will stimulate the parasites also. So what's really important is to come off of all caffeine, even decaffeinated coffee, because you don't want to stimulate the parasites. You want them as quiet as possible to treat. Once you're well for a period of time, you can test things. And if you've treated well enough, it's not going to bother you. But you might have different values then. So for me, it's like, I don't have the slumps. I don't need the caffeine. I don't really like the taste of coffee anymore. Like, I could drink decaf coffee, but I don't like that aftertaste where my husband's like, I need a piece of gum in my mouth, because coffee after a while doesn't taste that good. So your values change, your taste buds change, and you don't have the ups and the downs, and you'll find that you'll be like, I don't really want alcohol anymore. So we gave up alcohol, my husband and I, both years ago, because we love life, and we're in our 60s now, and we just can't afford to feel tired. We've got lots of grandkids, we've got animals, we're super busy, super active, and we love life. We're just so grateful for nature and grandchildren and our children and family and animals and the creation, and getting that second chance. And that's what we want for you. And that's those of us that work in Live Disease Free. So Caroline, Marissa, and myself, we all we're passionate about helping others get their health and their life back, because Marissa is a Live Disease Free coach, and myself, and we both recovered from MS. So farm animals are heavily infected with multiple things, lots of antibiotics, and be really careful with antibiotic use in animals. We just lost a dog, and he would get these hot spots on his neck, and then he was living with my son, and they'd put him on antibiotics, which they had to because it was a real acute bacterial infection, but his guts were so off. So it's the antibiotics that definitely are not good. So, giving our dogs, and I don't even know about probiotics. I'm going to look into that, but obviously they eat a lot of things where they get different microbes from the soil, good and bad. But parasite treatment is really important in dogs. And cows, they do treat. Horses, they do treat. All right, so I'm going to let you guys go. I just want to thank you so much for spending this time with me. And I hope this helps you to see, start thinking about your disease differently. Start thinking about, maybe it's not autoimmune disease. Maybe it's something totally different. And start looking at your blood work. Read your blood work. That's really important. Correct things before they get really out of balance. And we are going to be, maybe this will be something that I need to do is how do you eat an elephant? One bite at a time. Maybe we need to just do 1 week. We're going to talk about all the symptoms of Lyme disease and all the blood changes of Borrelia, and then Babesia and malaria, and start with the common parasites we know are involved with multiple sclerosis. And then we've got that database, and then we do the next database and get that into an app. And I really don't care who does this. I just want this done because I want to have these tools for our doctors, and it would be really helpful for our doctors. It would be amazing. So with that, I'm going to let you guys go. If this is the first time that you found me, make sure to check out our website, livediseasefree.com. Make sure to watch my masterclass training, which tells you all the steps that we take to recover from these awful parasites. You'll find that on our website. You'll find a link beside this video also. And otherwise, if you enjoy what I share, if you find it helpful, please help us to get the word out by liking and sharing and subscribing to this YouTube or Facebook, wherever you're at. So with that, I hope you have a wonderful week. Take care. Bye-bye for now.